Things patients do that doctors secretly hate. Visiting a doctor can be an anxious moment, but it's a vital component of curing illness and staying healthy. Here are 5 things patients do that make secretly annoy your doctor. Disclaimer: doctors are generally trained to show the utmost compassion and tolerance towards patients. A properly trained doctor should not let these behaviors affect their professionalism and cloud their judgment. Number 1. Patients will talk about their diagnosis rather than their symptoms. Whenever a doctor asks you, what is the problem, he expects you to explain the symptoms you are feeling in your body. Symptoms are bodily sensations felt subjectively by patients, such as headache, cough, abdominal pain, and so on. He doesn't expect you to say, I have malaria, I have migraine, I have ulcer. These things are diagnoses, not symptoms. Doctors are trained to evaluate your symptoms and use them to work out the possible diagnosis and not the other way around. Number 2, patients who bring unnecessary relatives to the consulting room. Because of our African culture, many things are done communally, including medical consultations. But there are many occasions where too many people affect the quality of the consultation process. Imagine a young woman in her mid-20s coming to see the doctor for fertility problems. And she comes with her husband, her mom, her mother-in-law, and her aunt. And she and the doctor are reluctant to excuse them from the consulting room out of respect. As much as possible, limit the number of relatives that accompany you to see the doctor. Except you are severely ill and unable to talk yourself, most doctors prefer to communicate with only the patient. Number 3, patients who bring children to the consulting room. We all love our kids, right? Do you know kids, they can be chaotic. Children, especially those under 5, play, cry, scream, and scatter the consulting room. They are very demanding and very distracting, and this can prevent the doctor and you, the patient, from focusing on the consultation session. Please do as much as you can and avoid seeing your doctor without your children. Many hospitals have staff who can watch over your children while you are consulting with the doctor. Number 4, patients have a hard time remembering their symptoms. As I said earlier, visiting the doctor can be a very nerve-wracking experience. Some, but most doctors really appreciate that you take the time. Calm down and explain every single detail of your symptoms. Imagine a doctor asking you, for how long have you been having a headache? I respond with something like, I don't know, it's just been for long. A clear and accurate description of your symptoms go a long way in helping the doctor make an accurate diagnosis. Number 5, patients who bring up other innocuous complaints separate from their main. We all know that patients may come to the hospital with more than one complaint, and many of these complaints have a hierarchy of severity. As much as you may find the need to explain every single complaint to your doctor, it really helps the doctor if you just focus on the main problematic rather than a host of minor and obscure complaints. Focusing too much on minor and obscure complaints runs the risk of derailing the consultation. It removes focus from the main reason you came to the hospital. It may now take the doctor time, and he may write unnecessary tests and medications that increase the cost of complaints or treatment because of these several complaints. So in conclusion, we all know that doctors are committed to providing the best possible care for their patients. However, certain behaviors can inadvertently impede the doctor-patient relationship and eventual delivery of optimal care. Till next time.